Hello everybody. It is Sunday and I've been on call all weekend. So it's 8 o'clock at night and we're gonna go round finally. I've spent all day kind of hanging out at the house, helping the wife with the kids. So now it's time to go round on some patients that we've collected over the weekend. Usually can't really make a video kind of like this, kind of like I was back in residency, because then that would just been a super busy video. But things are a little bit quieter when you're in attending. So I kind of wanted to give you guys an idea of what it's like to take call as a reconstructive surgeon on the plastic side during weekend. So Friday's already come and gone, Saturday's already come and gone, and here we are on Saturday. We've got patients at 2 different hospitals about 30 minutes apart. So we're gonna drive and we're gonna talk about the types of injuries that these patients have at each different hospital. And I'm a little tired today because I was up till 3 in the morning operating on one of them. And we're going to talk about him and all the extensive reconstructive surgeries he's going to need. So stay tuned. Hope you're ready to learn something. Here we go. All right, we're here. There we go. All right, so we have arrived at our first hospital. This is a level 2 trauma center here. Kind of check in and see where they have put my patients, because sometimes patients get moved around on the weekend. So that's the first thing we're gonna do. And then we're gonna go check on everybody. And then when I come back, I'll tell you what their injuries are and then what their plans are. And then it'll be on to the next hospital. So here we go. So first stop is usually the physician's lounge here. Don't always grab chocolate, but this time, yes. And then we're gonna find out where our patients are on the computer. Okay, we'll turn that down. So we're all done rounding here at our first hospital in North Austin. So we saw 2 patients. The first gentleman we saw was an elderly gentleman that fell down a few days ago, and it turns out that he has a fracture of the 5th metacarpal in his right hand. I know this is my left hand, but the 5th metacarpal, so is that last bone kind of here attached to the small finger. And he's got an oblique fracture there, so it's separated, and because of that he's going to need surgery for that. So he also had surgery on his hip that he broke today, so we're going to give him a day off from surgery tomorrow and likely do it the day after. But he's going to need to have the top of his hand have an incision on the top, and then we're gonna have to move all the structures out of the way, get down to the bone, and then put some screws in there to kind of help bring those bones back together. Our second gentleman we're gonna operate on tomorrow. He actually fell about 20 feet from some scaffolding while trying to hang some Christmas lights. And it seems like he may have hit his forehead on the way down on something, and then it spun him around on his back because he's got an injury to the front forehead region here, which is a depressed skull fracture. And those pieces are kind of caved in. So luckily it's just the outer table of the frontal sinus. So there's this little cavity up here in the skull. And whenever you get like a sinus infection or anything like that, allergies, you'll feel that pressure in here. That's from that sinus, that frontal sinus being kind of inflamed and full of junk in there. So he broke the front table of that, which is the one just underneath the skin here. There's another table of bone behind that that is just in front of the brain. Luckily, he didn't injure any of that, but because of the kind of caved-in nature of this type of fracture, we're going to need to go in there tomorrow and pop those bones back out, put a titanium mesh on top of that, and kind of help with that contour and help support it a little bit and help those bones kind of heal back into a better position. So there's a number of different options to repair frontal sinus fractures. You know, the more major ones are if both tables are involved. and it's pretty bad. You may have to work with the neurosurgeons to cranialize the brain, which means that you remove that posterior table of the frontal sinus and allow the brain to expand forward into that. But you kind of have to do some things to block the drainage from that area down into the nose. So sometimes you have to put some fat in there and block the little drainage tubes from the frontal sinus. Other options are just to obliterate the frontal sinus, where you just fill it with fat that you get from other parts of the body. But really it's all just kind of prevent drainage back and you know, kind of prevent or decrease the risk of infection up in that area from ascending infections up through the nose, because the nose is not a sterile place. So so those are our two patients here. I gotta find some time to get our elderly gentleman with a hand fracture on the schedule, because we have two other patients at the hospital down south, which we're gonna go see now. One of which is a very severe and major injury that's gonna take up a lot of time this week to even start putting him back together. And we'll talk about that here in a few minutes. So after another short drive back down south, here we are at our next hospital, and we got two more patients to see. Okay, so we have arrived at our last hospital for the night. I'm still on call tonight, so I could very well be called back in here, but we'll see. Hopefully not. But we have two patients here to see. One patient has a mandible fracture from a fall, and it looks like, based on the scan and depending on her symptoms, whether or not her teeth are fitting together correctly, we may need to operate on her as well. And then our last patient, which is probably the most severely injured, is a gentleman that last night I had to take to the operating room because of a self-inflicted gunshot wound to the face. So I was up till about 2-3 o'clock in the morning, controlling some bleeding and just kind of getting the lay of the land as far as what the extent of his injuries are. And it's pretty bad. So there's a lot to talk about with those kind of issues, those kind of injuries. It's one of those types of injuries. There's a few that I kind of lay awake at night before I go to bed, hoping that I don't get called about. And you know, usually between Thanksgiving all the way to around New Year's, you can kind of expect that this is the time of year where these types of situations typically go up and tend to occur more often. So unfortunately, I got called in about one of these last night, and we're gonna have to work with this gentleman over several surgeries to really get him cleaned out, get everything kind of debrided, because the problem with gunshot wounds is that it's not only the bullet itself that does the injuries, but also the shockwave from the bullet passing through things, or even, you know, if it's point blank range, the injury itself. He's got a very large wound here on the underside of his chin, and then it essentially broke his jaw into multiple pieces. It blew out the left side of his upper teeth, and then all the structures that actually make up the nose are pretty much gone. Luckily, however, it seems like the blast kind of just separated everything right up the midline and kind of filleted everything open. So all of his skin seemed like it was doing okay last night. However, you know, the shockwave from the injury itself may kind of make that a little different here in the coming days. So he's going to need multiple operations to clean out all this tissue that may be in the process of slowly dying before we can really even begin to start reconstructing him. And he's going to need multiple surgeries over multiple months before we even get him back to kind of somewhat of a normal appearance. So we're going to go check on him right now, and then make plans for everyone else. So I'll give you an update when I get done. All right, we are done. We have rounded on all of our patients. I can get the lights on here. There we go. We have rounded on all of our patients. Our lady with the broken jaw, it's not too bad of a fracture actually, and it's actually only on one side, kind of really high up in here in the ramus area. So her teeth are fitting together, but not too badly off. So she and I discussed whether or not she really needs surgery. You know, if her teeth aren't fitting together correctly and it's bothering her, it might be something that we need to pursue. However, she's in her 80s, so to do surgery, you know, there are some risks involved as you get higher up in the years. But ultimately, you know, she wants to kind of think about it and talk about it with her family. So we'll wait to hear back from her if she wants to pursue surgery or not. So our gentleman that has the self-inflicted gunshot wound to the face is doing well. He's awake. His breathing tube is down in his neck, so to speak. So he has a tracheostomy, and he's awake. He will interact with me, and we kind of discuss what's going on with him. In fact, now I've got him on the schedule for tomorrow afternoon. Take him back and wash him out again and make sure that some of that dead and dying tissue starts to really kind of get cleaned out of there, so it doesn't become like a nidus for infection or anything like that. So we'll probably do that a couple more times this week before we even start talking about reconstructing him and start putting the pieces back together. So he's got a long way to go, but you know, it is now 11 p.m. We started this whole journey around 8 p.m. So you know, maybe about an hour of that was driving, since 30 minutes north, 30 minutes back south. But that is the nature of covering 2 level 2 trauma centers, one on the north side of town and one on the south side of town. So overall, not too bad of a weekend, but slightly busy. So now I'm gonna head home. I'm gonna write all my notes and then go to bed and get ready for my cases tomorrow. So hope you guys enjoyed this. I'm not really sure if this is something I'm gonna do quite often, but I figured, you know, I haven't really made a video in a while on this channel, so I figured I'd kind of take you guys along tonight with me rounding and let you kind of see what it's like to kind of, I guess, clean up from the weekend from taking trauma call as a reconstructive plastic surgeon. So hope you guys all enjoyed this. I guess leave me some comments down below if there's anything you want to see more of on the channel here, or if you have any questions about some of the cases that we discussed tonight. So hope you're all doing well. I'll see you on the next one.